Hi guys, I'm back. On this episode today we are going to talk about sickle cell disease. I believe we are all familiar with that. So what is sickle cell? Sickle cell is a genetic hemoglobin disorder in which the red blood cells change shape. Red blood cells are normally donut shaped, but in this case they become like the shape of a half moon when the moon is half, or a sickle. Like for those of us who are farmers, there's that thing called a sickle for harvesting millet, and yeah, we know it derives its name from there. So what causes sickle cell? Sickle cell is caused by a mutation on the HBB gene, where valine replaces glutamic acid at 0.6, so it results in hemoglobin S. So yeah, that is it, and it is inherited. It is inherited in an autosomal recessive form, meaning the individual must have 2 copies of the mutated gene. So that means if 2 parents, the father and the mother, both have the mutation in them, then they can give birth to a child who is a sickler, who has the hemoglobin S. So you have to have the mutated gene, 1 copy as a father, 1 copy as a mother. It is the reason why couples, before they get married, they should do this sickling test so that they do not give birth to sicklers. It's actually a requirement. Yeah. So what are the signs and symptoms? Usually the onset is 3 to 6 months. Yeah, starts 3 to 6 months, and then you find the child having anemia, the hands, the joints are swollen and very painful. Then the episodes of pneumonia are frequent. Then there is recurrent severe infections. Yeah, those are basically at the onset. Those are the things you'll see. And every now and then, mostly you'll see the child runs out of blood, needs to be transfused. And then after a short while, another episode of anemia comes in and all that. And usually when these children get sick, it is very severe. Yeah. So they also experience vaso-occlusion, like the blood vessels get blocked, because when those sickle-shaped red blood cells clog together, they can block a blood vessel, which results in severe pains in the chest, in the abdomen, in the back. Like when they block those main blood vessels, the child can experience vaso-occlusive phenomenon, which results in a lot of pain, abdominal pain, back pain, which is very severe. Yeah. Then the diagnosis is made by doing a complete blood count. Then you can do a peripheral smear. A complete blood count usually reveals certain things: anisocytosis, poikilocytosis, then peripheral film comment. Then you can do sickling test. Sickling test is done as a screening test. If it's positive, it doesn't mean you have sickle cell until you do hemoglobin electrophoresis. So yeah, then you can do liver function tests and renal function tests. Yeah. And then the treatment, since this is something that is not going to cure, it is inherited, we have to do regular follow-up and education of the patient and the family members so that they can be the support system. encourage them to stay hydrated, drink a lot of water, drink a lot of fluids. Yeah. Then we give folic acid for life. Every day they take a tablet of folic acid for life. Then we have to ensure these children are fully immunized. Yeah, the immunization schedule. They're immunized against all those immunizable diseases. Yeah. Then we give malaria prophylaxis monthly. Consider every month. Then we give prophylactic pen V every day. They have to take pen V until they're 5 years, because we all know children below 5 years do not have that strong immune system, so they are prone to certain infections. So if we give them up to 5 years, by then they would have built some immunity towards these common organisms. Yeah, so pen V is given up to 5 years. And then the other treatment option that is considered a lot lately is the use of hydroxyurea. But hydroxyurea is given on certain conditions: the renal function tests, the frequency of the attacks, and all that. So the bottom line is, most of these, let me say all these sickle cell patients are supposed to attend the sickle cell clinic. And in Uganda, we have the clinics in all the regional referral hospitals. So let's keep appointments as parents or caretakers or guardians. Take these children to their appointment so that they can receive these. And trust me, if you take them regularly for checkups and all that, they will be more healthy, the frequency of attacks will reduce, and they'll be more productive. But if you don't take them, they can be more sick, and then their productivity will be low. They cannot play. You know, children are supposed to play. Yeah. So sickle cell is common, and we have to be, if you see a sickler, be supportive, do not criticize. If you know any parents who have sicklers, kindly support them and be kind to them, because it's not easy. And lastly, to those intending to marry, ensure that you do the sickling tests, the HB electrophoresis, as you are doing the HIV, syphilis, and other tests. As you're screening for STIs, also screen for genetic diseases. Yeah. Have a lovely day. Bye.